What is the recovery period for buccal fat removal? If you're considering a procedure to slim down your cheeks and define your face, you might wonder how long it takes to recover. Buccal fat removal is a popular facial aesthetic procedure that targets the fat pads in your cheeks to create a more sculpted look. The good news is that the recovery period is generally short and manageable, with most people returning to their normal routines within a few days to a week. Right after the surgery, during the first 3 days, swelling and some discomfort are common. You can manage these symptoms with prescribed pain medications and cold compresses. Keeping your head elevated and sticking to a soft diet can help reduce swelling and promote healing. You might notice some bruising, but it usually starts to fade after a few days. During this initial period, it's best to avoid strenuous activities and heavy lifting to prevent increased swelling or bleeding. By days 4 to 7, swelling often peaks but then begins to decrease. You might see the first signs of a more contoured face as the swelling subsides. Many patients feel comfortable enough to resume light activities and normal eating habits, though vigorous exercise should still be avoided. It's common to experience some asymmetry during this time, but that typically resolves as healing continues. In the second week after surgery, most people are able to go back to work and daily routines. Swelling and bruising continue to diminish, and facial definition becomes more noticeable. Gentle walking or stretching is usually fine, but always follow your surgeon's advice. By the 3rd and 4th weeks, external signs of surgery are usually minimal, and patients often feel fully normal again. At this point, the cheeks look more sculpted, and the facial contours are clearer. Long-term, the results of buccal fat removal are considered permanent because the fat is physically removed during surgery. Residual swelling generally resolves within 6 weeks, allowing you to enjoy your new, more defined appearance. It's important to follow your surgeon's instructions for long-term care to maintain the results and keep your face balanced and harmonious. Overall, buccal fat removal offers a relatively quick recovery compared to more invasive facial procedures. Most patients see noticeable improvements within a month, and the results can be quite satisfying. Remember, individual experiences can vary, so always consult with a qualified healthcare professional for personalized advice and guidance.